One exciting thing that happened in the year 2019 was the Vertiflex company that I've talked to you about was purchased by Boston Scientific, which is a big giant in the pain world and really in the spine world at large. And so what's great about that is that now we have two therapies from one company that can treat very different conditions. And so sometimes it's one or the other that helps the patients, and sometimes it's a combination of both that helps the patient. So what I mean by that is I want to give you a very simple test. If you have a patient that has pain in their back, and if you lean them forward and their pain alleviates, and you lean them backward and their pain accentuates or gets worse, then you want to be thinking about a spinal stenosis diagnosis. So you're going to also ask them about pushing a grocery cart. And if they tell you that when they push the grocery cart at the store, their pain is better or they can walk further, be thinking about spinal stenosis. And again, Boston Scientific has both these devices. So in the people with spinal stenosis who have an anatomical problem, we're putting in the Vertiflex. But for many years, since even back in the 70s, we've been using spinal cord stimulation as a way to treat pain. And the main indications for this now are pain from post-laminectomy syndrome or previous surgeries that didn't help the patient, people that have vascular insufficiencies or problems with their blood supply, or people that have something we call chronic regional pain syndrome. And chronic regional pain syndrome, as you know, can affect many different parts of the body, but oftentimes is found in the extremities. So these are some of the reasons we would go forward with a stimulation trial. So what we do is we get a psychological evaluation for the patient. We then take them through a process called the stimulation trial. And during that trial, that we're just putting needles into their back under fluoroscopic guidance and placing leads up in their back to kind of simulate what it would look like to have an internal placement. This here is a kind of a model, if you will, of what the battery would look like if a patient decided to go on and have a permanent implant. And the implant can be either sewn down to the bone, something we call a laminotomy paddle, or it can be leads that are just what we call percutaneous leads placed in the epidural space. And so this is a short trial of about 5 or 7 days to see if they get good relief from the symptoms that they present with. And if they do, then we will go forward with a stimulator implant, and that gives them the ability to control their own pain by using their device that is a battery that's internal, and they charge that battery from an external source. So Boston Scientific now has two very large players in the pain world between their Vertiflex and their stimulator option. And so these are two procedures that we'll be doing a lot of in 2020.